Welcome to the CaresLink podcast. Today we have an amazing guest, Dr. Monica Esposito. She is a family medicine physician and the founder of Ascend Concierge Medicine. Dr. Esposito, thank you so much for being here.
Thank you so much for having me. It's a pleasure.
To get started, would you just give us a little bit of your background, your training, your education, and what led you to want to become a physician in the first place?
Sure, of course. So if we want to go kind of chronologically, I initially decided that I wanted to make that transition into being a physician when my brother was roughly 10 and I was about 13 years old. Unfortunately, he became acutely ill and actually almost died. He ended up requiring airlifting to Miami Children's Hospital, ended up being dialysis, ended up on a medically induced coma. He had a crazy illness where it was something called mycoplasma pneumonia. It's typically something that causes a fairly mild course, and people very routinely in the population get this. So normally not something that attacks the system in this way. But in his case, he had a few recurrent infections and it hit him while he was down, and he became critically ill, requiring ICU and intubation, the whole 9 yards.
Wow.
And when you're undergoing something like that as a family, it's extremely stressful. And, being outside of the medical side of things, you feel like you have no control over what's going on with your loved ones. And it can be very frightening and very frustrating. And, for us, seeing my parents and seeing how this whole thing incorporated and really stressed our family in such a way, I didn't like that feeling, and I wanted to help other people that were going through that sort of circumstance. I wanted to be the person that could help both on the health side, but also communication, making sure that people understood what was going on. Because I think part of the scariest thing was not really fully having a clear picture, not understanding what was happening, how critical it was, what the options were. So when I decided that I wanted to take this pathway, part of what I emphasized was making sure that I was going to be an excellent communicator, making sure that I was always going to be able to advocate for my patients, and making sure that I could take something that would have potentially been a worst time in their life and make it just a little bit easier, a little bit more palatable, and a little less frightening. So, once that kind of hit me and I stuck with my science background, I ended up studying at the University of Florida. I did my bachelor's down there. Go Gators. And then I went over and did LECOM in the Bradenton campus. It's an osteopathic medical college, which was exceptional. I got a great education there. And then I met my husband while I was in practice there. So we ended up bidding together, and I stuck in the Bay Area and ended up at St. Pete General Hospital for my residency. Okay. And the rest is history. So it all worked out perfectly for my family.
That's so powerful that you took such a challenging time and turned it into this career helping people. Just out of curiosity, how does osteopathic medicine differ? Or how did your schooling differ from a traditional medical education?
Sure. So really, the education process between the MD versus DO pathways are essentially identical with one major exception. With osteopathic pathway, we incorporate something called OMT or OMM. It's osteopathic manipulative treatments. So we learn an element of hands-on treatment that we can utilize. A lot of it mirrors what people associate kind of with the chiropractics, but oftentimes it can be less invasive, where we help people engage their muscles in such a way to realign or adjust, body areas that have kind of gotten out of whack, so to speak. I think it also, as a whole, tends to be a slightly more holistic approach. Now, that said, you can have physicians with either degree that take that approach, but I think as a whole, osteopaths tend to automatically have that drilled in from day one, even in the education process. So that's kind of where we differed.
That makes sense. Mm-hmm. So you mentioned your residency in CP. Mm-hmm. Where did you go after that?
So my initial time frame prior to starting my own business, I worked with a local company called Access Health, And basically it's, one of the, big corporations. They hire on many physicians. They have lots of different clinics within the state of Florida. And a lot of their patients are, these HMO Medicare patients. So a lot of it's capitated plans. So it's a relatively specific clientele for the most part. We did see some fee for service, but predominantly we dealt with those HMO Medicare.
Okay. And how long were you there before you decided to start your own business?
I was there for 5 years, and then I ended up going off on my own last September and opened Ascend Concierge Medicine this past March. So
congratulations. And on you. I know that's a big step.
Major undertaking for sure.
Sure, yeah. Was there a moment or set of moments that kind of led you to wanting to start your own business, deciding that that was the right path for you?
Yeah, I think it was kind of a series of things for me. So in terms of my style of patient care, I have always been the type of person that I function the best when I can take my time. I like to communicate, listen, sit and really interact with my patients, get to know them, because I do think that it lends to a better level of patient care, and you tend to miss less that way. Yeah. But that said, it can be challenging when it's not your own place. You have a schedule to maintain, you have certain metrics to uphold. And, in this type of situation, these are a lot of medically complex patients, a combination of Medicare because of age, but also Medicare because of being on disability. So these people need a lot when they come in typically. And oftentimes, some of these people were just lonely and they wanted to be able to have a conversation. And I've never been the type to want to rush out of that. And I want to always make sure that they feel valued. And I think it's a little bit more challenging when you're doing that in a setting that you're not the person that's structuring the exact time frames and schedules. And, I helped along with, some of the nurse practitioners or things along those lines and training. And there was a lot of behind the scenes paperwork. One of the things that's the most frustrating, I think, with dealing with kind of the HMO Medicare thing in general is dealing with authorizations. So picture, if you will, I want to order an MRI for your back problems because you're having shooting pains into your legs and it's very, reminiscent of some sort of nerve issue. Sure. I order said MRI, and then the insurance company wants me to authorize the MRI that I ordered. Okay. So it's just kind of an extra jumping through hoops. Now, we did that for every single thing that any specialist ordered as well. And in those cases, at least it was something that we hadn't ordered and we needed to be aware of, to be fully, involved with every element of their patient care. But when you're doing it for every single thing outside of maybe some basic blood work, it adds a lot to the plate of what you're doing throughout the day. And it takes away from time that you should and could be doing more just patient care oriented things because you're dealing with a lot of the behind the scenes paperwork and, the stuff that no physician really enjoys doing.
Absolutely. Yeah. It sounds really challenging. And then I'm sure it also kind of takes a toll on you emotionally as you're trying to provide good care. And then you're constantly feeling like you're not able to do what you genuinely want to do.
Yeah. I think, with the way that generally healthcare has gone, we've seen a big shift in terms of, reimbursements for physicians have gone down. So anything in any of the arenas, whether it be corporate or otherwise, that's dealing with the insurance model, everything tightens up, and the drive to see more patient volume to ensure that everything is charted exactly the way it needs to be. All of that is increasing, but at the same time, your patient's needs aren't decreasing. Sure. So that's part of what's leading to this, epidemic of physician burnout. You're seeing so much more of good physicians jumping ship and going into either, non-clinical pathways like utilization management, or even some people retiring early. And then there are people like me that, see it as an opportunity and are like, well, if this isn't going to be working for me, what can I do that would be able to keep me in the healthcare pathway, but do it in such a way that's sustainable for me, my, own well-being and that of my patients. And, for me, part of the other side is during this time frame, I was starting a family. at this point, my kids are just shy of 3 years old and just shy of 5 years old. So as you can imagine, things were a little hectic in our house. And, as a mother and as a wife, you have to be able to marry these elements and not just be a good physician, but also be, at this point, a good business owner, a good wife, a good mother, and devote appropriate time to every area, not just patient care. So this evolution happened out of really, I think, necessity for me, and that I needed to know that I was going to be taking exceptional care of my patients, that I was not going to be detracting from what I could offer them, but I was also going to be able to provide that excellence at home, and that I wasn't going to be an absent mother, that I wasn't going to be an absent wife, and that I could maintain that elusive work-life balance where everybody's happy. And ultimately, I'm not getting burnt out, because that's doing a disservice both to me and my family, but also to my patients. If I'm not at my best, I'm not giving them my best.
Okay. Yeah, absolutely. It's admirable that you've chosen to kind of chart a new path that allows you to prioritize both patient care and your, home. What about Ascend solves those problems for you? How have you set it up to solve the problems that you were seeing?
Sure. I think in part, simply just having my own autonomy back and being able to take that control is element number one. I mean, in my practice, I chose to not go with, an MD VIP or something corporate. I am completely charting my own thing where it's just me running the show, and it lends to some challenges that are unique in that everything falls back on me. And I had to do a lot of learning and seek out a lot of help from those who had more experience than me in the different areas as we, created this new company. But it also allowed me to be a little bit more deliberate with every decision that I made. So, in part, I chose a location that was close and convenient. My office is 7 minutes from my home now. So instead of having a commute, 45 minutes each way, it's right down the street. If I need to pop home or pop to the office for whatever reason outside of the regular hours, I have that ability to, and it's very easy for me. I think number 2 would be the fact that I structured it in such a way that my time frames with each patient are going to allow for that one-on-one time. My average intake appointment is a 90-minute appointment. We go through everything as comprehensively as possible. My follow-ups are 60 minutes, whether it be a telehealth or an in-person. If people want to come in for, just talking about preventative health, if they wanted to go through and figure out a fitness and diet regimen to help them optimize, if they want to talk about their diabetes or their hypothyroid or their menopause symptoms, we can go into all of that, and I can sit and listen and intake all of it and not have to rush through the process. So that's huge in terms of patient care. And then ultimately, when I was setting up the number of patients and the volumes that I want to see, you're getting typically in the normal fee-for-service industry, you're averaging 1,500 to 2,000 patients for a physician under their care. And that number has actually gone down some from what it was originally. It was over 2,000. But in this element, for my office, I'm going to max somewhere between 250 to 300 patients. So I'm going to know every single one of those patients well. It's not going to be, I have to look it up if they call me because I'm not sure who it is. I know them. I know their backstories. I know their health issues. And I don't have to worry about the stressors that come with scrambling to figure out who you're talking to and what's going on and getting patients mixed up. It simplifies things when you have your patient panel. They're just yours. You're not mixing back and forth with different providers in an office space and, this person saw them last time, but now I'm seeing them and I don't know what's happened. It's just me. I'm the one that's seeing them. And ultimately, even when we expand upon our existing model, it'll be that you're with your physician. That's how it's going to always be. Yeah. We're keeping it so that your physician. You're not knowing the practice, you're knowing the actual doctor that you're taking care with. And I think the one-on-one attention lends to better care and ultimately a better connection that is helpful for both sides.
Sure. Absolutely. I think there's something therapeutic about the connection you have with your provider, like along with just, the actual care. So I'm sure that's reassuring for your patients. Could you talk a little bit about the business model, like concierge medicine, versus direct primary care, how they compare, how they differ?
Sure. So there's definitely a lot of intersection, and you'll see more intersection in some of kind of the more affluent areas than others. Traditionally, concierge medicine is similar to direct primary care in that it does have the membership model. So people will pay a monthly or yearly membership fee, and it incorporates, all of the services that physician provides. Now, that said, true concierge medicine typically is going to also incorporate the insurance side. So usually they will be billing insurance on the back end, so they have both sides kind of simultaneously existing.
Okay.
True direct primary care traditionally is going to be a simplified version in that it's membership based only. We do not directly involve insurance in any way. The only way that insurance is involved is if patients carry insurance, we'll, put their labs or their imaging or things like that through their insurance. We'll set them up with a physician for, the colonoscopy through insurance, things along those lines. So they can still utilize it, but we don't use it on our side. Now, my practice is sort of a unique animal in that I take the true direct primary care model, but I elevate it and sort of have a concierge spin on it. The area that I'm working in, it's the right approach, I think, but I really liked the simplified version of not having to incorporate health insurance. I think the way that things have gone with everything, it's really been difficult for patients to mess with insurance. It's become more and more complicated. It's become more and more expensive. So it allows me to still take care of some patients that may choose not to carry health insurance, and they can get exceptional care going the concierge route. And with my, concierge flair, I do incorporate a lot of the additional add-ons. So I have a lot of things in the practice that I automatically will include with that membership fee. Aside from just the straightforward, as many visits as they need, they can get a lot of their kind of ancillary benefits that true comprehensive primary care would incorporate.
Okay. You mentioned earlier there's a bit of a push towards this care model among your colleagues.
Absolutely. Yeah, we're going viral.
Yeah.
So, with the crazy chaos that's been going on politically and everything that's happened with the insurance companies, premiums are outpricing a lot of people. And, especially for those people who, either are in the lower socioeconomic end or just simply people that own their own businesses, but they're on the early side. So people like me, people that they don't have an automatic avenue for insurance. Maybe they don't have a spouse that's employed and they need a way to still get healthcare and, maintain their general preventative stuff. Maybe they have a concern. Maybe they need a pap smear. Maybe they need, some basic blood to see if they're anemic. Maybe they just have questions about their blood sugar, any of the above, even for simple urgent care visits. But a lot of people are actually making the deliberate decision to ditch insurance entirely or perhaps go for just catastrophic coverage instead of the traditional model where they're getting everything covered. And they'll go for somebody like me to manage all their routine health. And in some cases, it's actually less expensive and you still get this amazing care and one-on-one attention that really insurance isn't helping with right now.
Yeah, I can see how that would make a lot of sense for different people. You mentioned you do routine healthcare, of course, like primary care. What else do you offer within your business?
Sure. Well, with my background, I've always been an athletic type of person and I'm big on wellness. So part of my approach is being very proactive. I'm very into preventative medicine. I really like to push and offer my patients everything that's out there that could benefit them on an individual basis. So in some cases that may be, doing extra cancer screenings or, doing some of these newer things like the Gallery testing or, genetic testing.
Okay.
Or, coronary calcium scores with CTs to, evaluate for, any sort of disease process, even in the absence of active symptoms. But outside of the preventative realm, we do the urgent care type visits. So you don't have to worry about going and calling an urgent care, if you're sick on, a random time frame and you're like, oh my gosh, I need to figure out what to do here. We do our pelvic exams, hormone replacement, and also testosterone for our gentleman clients. We do joint and trigger point injections. So people don't have to outsource every time, if they have an arthritic knee and they need a shot, I can do that in the office. As long as we have, an x-ray on file, we're good. It simplifies things. They can get things readily without having to wait to get into a specialist for every little thing. Trigger points for non-invasive pain management, wound care. We do IV infusions. So, if we have patients that are, acutely ill with a GI bug or they're on chemo and they're dehydrated, we don't need to send those patients to the ER. Even for something like a migraine. Sometimes we'll have them get an IV, get a shot of Toradol, get a shot of Zofran. These are things that a lot of times people are going to the ER because they have a terrible migraine, but it's something that in primary care, if we have the things available to utilize, we can save them that huge bill from the ER. And honestly, save the ER from having needless visits, especially when this time of year, as we start getting all the increased illnesses, it gets chaotic in there. You could be in there for a few hours waiting to be seen for something simple like a migraine when you could see your primary care doctor. And I could take care of that in the office without trouble, and you don't get a bill because it's already included in your membership.
Absolutely. Mm-hmm. That makes so much sense. I want to move on, if you're ready, to a little bit of the business setup. So when you started Ascend, what business structure did you use? Were there any tax implications or anything that you were thinking about when choosing a business structure?
Sure. So I have a CPA, and he was helpful in, trying to, evaluate that whole process. We ended up going with an LLC for our initial structure. I actually spoke with him and my lawyer who was helping with some of the other contractual elements. And, there really wasn't a tremendous difference in my area for doing LLC versus PLLC. So neither one of them was particularly concerned with that. But the plan is to evolve to an S Corp once the income is an appropriate level. It wasn't really necessary in the initial stages once there's no income associated with the practice, but that's something that we will be evolving to, I'm sure, fairly shortly. Okay.
Mm-hmm. And then what were the biggest hurdles when setting up the practice? Was there any paperwork that was particularly difficult, took longer than you thought, or anything else?
I think the biggest challenge was the unknown, the fact that as physicians, we're trained in so many things. We get so much great education, and, we can diagnose top to bottom, and we're great at that. But at the same time, I think they really don't give us any sort of training in business ownership and going out on your own. We're almost trained to work for the system.
Yeah.
So there's a lot of trying to kind of figure things out as you go, and trying to, both read into things, but also talk to people that have already survived the process and, have gone through it themselves. And I think a lot of it is you don't realize just how time consuming and how long some of these processes take. So for example, when we were looking for a space to, use for our clinic, we wanted to have a brick and mortar, not just telehealth, trying to find that space. And then once we found it, negotiating the lease, figuring out all the details for setting everything up. It takes months and months. And, the fees and everything that can be associated with some of these things, I think, are also higher than maybe one would anticipate or realize, just because if it's not something that you've ever messed with in the past, all of a sudden you're like, okay, well, this is something that I have to do and have to spend, and it is what it is. If you just kind of roll with the punches. But it's an interesting ride to be on, and it's definitely not something that can really be rushed.
I can relate to what you said about not really having much education going into it. I'm a physical therapist, went to physical therapy school, and, a lot of people do open their own practices in physical therapy, but a lot of people want to, but are so nervous about all of the business aspects that it's just, it becomes an insurmountable thing. What about things like insurance, like liability coverage, that sort of thing? Has any of that been challenging?
So I think one of the scariest things was going from being an employed physician where, my medical malpractice was covered to having to ensure that I either had nose or tail coverage and started maintaining my own, liability coverage. That was a bit of a challenge. I learned a lot about the whole process of, okay, well, as long as you have, either tail or nose coverage, you can get by. Tail coverage is, I think, what most people kind of associate with when they leave a practice. They need tail coverage in order to cover any of that time that they were there, because people can still do claims even when they're outside of that practice.
Okay.
It tends to be fairly expensive, and it tends to be a lump sum rather than something that you pay over time. So to the tune of, $45,000 or something along those lines. And for somebody that's going out on their own and starting a business, $45,000 is not, it's not chump change. It's a significant amount of money to just be like here and not actually get anything, tangible from that money. So I learned something about what's called nose coverage. And basically nose coverage is incorporated into your new panel. So instead of opting for a separate tail policy and having my new policy, I incorporated nose coverage. And it did allow for me to do a much more affordable option while still maintaining the really high level benefits that I had with my previous company. And the nice thing is too, I was able to start it out at a part-time level because, as you know, when you're starting from complete scratch at 0 patients and working your way up, you don't need full-time hours of patient care until it evolves into a bigger thing. So they worked with me and they said, okay, we'll give you a policy. We'll have this, nose coverage on your policy, and we'll have you as part-time initially until you get to the point that you're working full-time patient care hours. So it helps with people that are having to take that leap and start out, and does help at least in one area to slightly limit that cost, which we'll take any little help that we can get as long as it's not going to compromise anything, right?
Yeah, absolutely. That's really helpful. Mm-hmm. Oh, so you mentioned lease negotiation earlier. So you have a physical space for Ascend Concierge Medicine. How did that go, like actually finding a place that worked for you?
So I found this gentleman, John Lochner. He was amazing to work with. He really was helpful in terms of taking my vision and what I wanted for my space and coming up with some different options and places around town. I had kind of a specific radius. I wanted to keep it where it was relatively close and convenient to the home. I wanted to keep it in, the right type of area. I wanted easy access for patients, because ultimately, if it's difficult for patients to get to you, especially for, people that are elderly or have any sort of, movement disabilities, that's not good for a physician office, especially for primary care, right? So these were all things that we prioritize or lifted spaces. And it's amazing. Even, places not having a bathroom in the office. Mm-hmm. These things are challenges when you're looking, especially for primary care. If I'm treating a UTI and I have to say, hey, you can go down the hallway and, go find the bathroom. You just go around and then bring this cup and then bring it back. That's not really the right way to do it, right? So, we looked at probably 5 or 6 different places, many, many more online. And we ended up finding this beautiful space at the Magdalene Center in North Florida. And I have no regrets there. The people have been great to work with. The space is absolutely beautiful. I definitely had to have a little bit of a vision in terms of the interior, because it actually was initially more of a corporate type space where, they had one large area that they did conferencing, and I, rearranged it. We put up walls and made our whole construction thing and figured out what we wanted to do with the space. And once we had our plan, we actually were able to incorporate all of the construction element into my lease. So, John was helpful in that not only did he help me find a space, but also with the process of figuring out what we were going to be asking for, and kind of these letters of intent of, this is what we want with the space. This is what we want to have included with the lease. This is, how much we're willing to pay. And, once we got past that initial phase and he got me set up with them where we were kind of all on the same page, then the lawyers came in, and, you have to work with lawyers on the lease for all of the nitty-gritty details. And that process is a whole nother animal, and these leases are extensive, and, all of the legal jargon is not something that this doctor loves. But, that's why lawyers are there, right?
Absolutely.
We seek out help in the areas where we have our own deficiencies. So,
yeah. It's so interesting talking to founders. Sometimes, people talk about when you're starting a business, you end up with all of these different skill sets. And I definitely hear that in your story. The interior design, the vision, all of these different things.
It's fun. You get to learn that your limitations really are less than what you maybe perceived, and that you have a lot more ability to learn and grow into these other realms than you would have ever thought possible. It's really cool.
Yeah, absolutely. Were there any invisible costs or surprises in terms of, expenses? Some of the business things you weren't expecting, because you mentioned the liability insurance. Is there anything else that was surprising?
I mean, I think the insurance alone it's invisible, but we all sort of know it's there. It's just a matter of there are so many different layers of types of insurance that you need. I think it's not so much that there was a really large surprise expense, but there are a lot of these little nickel and dime things, like paying for biohazardous waste removal, little stuff that even in the early days that you're not necessarily utilizing tremendously, but you still have to pay for. Your licenses for medicine, but also your licenses for having the practice itself for, the county of Hillsborough. Things along those lines. Then they're small, but they add up, and you don't necessarily think about these things when you're doing your initial math. You're like, oh, okay, I need to pay for XYZ medical supplies. And those are things that are tangible that you think about, but you don't necessarily always think about all of the little expenses that you don't physically see on a day-to-day. So I think those are kind of the surprises. The other thing that got me was, we had our little kind of mock overview of the office where we weren't going to get in trouble for anything, but they kind of overviewed and made sure we were up to compliance on everything. Mm. And we realized that we didn't have an eye wash station, so we worried about all these things for ADA compliance and making sure that the office was set up, but we had to add the eye wash station. So going through and making sure that we had the appropriate, compliant temperature levels for the eye wash station, and getting the plumbing done, and purchasing a unit that fit in our existing space with our existing sinks that wasn't going to be physically in the way for, utilizing the sinks on a regular basis. So little stuff like that can kind of make things a little more challenging. Sure. But we roll with it. I mean, there's always going to be little things with any business ownership. So
absolutely. Yeah. It sounds like you've handled lots of small little things with a lot of grace.
Yeah, we put out little mini fires, but that's what extinguishers was for.
Sure. Yeah. So we've kind of set the foundation, discussed the big business structure. Mm-hmm. I want to dig into what your day-to-day looks like running this business. What's a day in the life?
So, I mean, it's really variable for me right now at this stage. I have a mixture of, seeing patients with the existing patients that are already on my panel. We also do, free consultations for anybody that is interested in joining. So I'll have the consults kind of scattered in within my day, and, I'll bring people in and talk to them about the model and how things are different in our practice, and allow them to meet me and also me to meet them to make sure that it's a good fit prior to anybody really taking that leap forward and, signing up. I have my meetings with my office manager so that we can, make sure that we're on the same page with our business plans. I believe that it's important to incorporate any staff members in with, a combination of the decisions, but also allowing them to take ownership in the vision and letting them be a part of that growth, because I think that it lends to people that are more committed to the future of the company, and also people that want to grow with you and succeed with you and stay long term, rather than having a lot of this turnover, which is honestly an epidemic in general medicine. You ask any physician office that one of the biggest frustrations is dealing with the constant staff turnover and people leaving, people, having issues with, the setup. it's very difficult to have to constantly retrain and go through the process of onboarding new staff members for every little thing. So incorporating that, that concept of wellness through the company and have that mutual respect there really helps. So I really try to make sure that they feel like they're involved in more than just their day-to-day, answering the phone during patients. It really does help with the connection there as well. Lots of fun with accounting or things like that, making sure that bills are paid, making sure that I can be my own accountant, keeping track of, the random odds and ends. I do a lot of, networking with local physicians, but also other healthcare providers. I'm big on making sure that everything is easy for my patients. So part of what I've really, sought out to do in the early days was create this really strong network of everybody that they could possibly need, whether, it's a psychiatrist or, an acupuncturist or a neurologist or, endocrinologist. And if they want cash pay versus if they want somebody that's with their insurance companies, I have options for all of these. And they're all people that are trusted in the community. They're all people pretty much that I've actually met and interacted with personally, so that when I tell my patients, hey, I want you to go here, I think this is a good place for you. You can go anywhere you want, but this is somewhere that I recommend. I can really recommend it, and I can say with confidence that they'll get exceptional care that's up to the level that I expect for my patients in those locations. So that's been something that I've tried to kind of prioritize to make sure that as I do grow, that my patients are going to get everything they need, both inside and outside of my clinic.
I hadn't really thought of that, because when you work in a healthcare system, you automatically have a network. And then so I can imagine that that's an important thing to build when you're on your own or starting your own business. So the concierge model, like you're very accessible to your patients, right? Essentially like 24/7 accessibility to your patients. How do you maintain boundaries with that? Have you ever gotten to a place where you're like, wow, that maybe this, it's hard to, do all of the mom things and the family things and maintain that level of accessibility with your patients?
Yeah, I mean, I think that as a physician in general, even when you're, hired on corporate, I was still on call sometimes. I was alternating call, but I was still on call. And with this, all of my patients know me. I know them. Calls tend to be easier that way because I already know what they're calling about. It's not like I have to try to reinvent the wheel and look them up and try to figure out and see if they, had appropriate documentation to know what's going on. And my patients are respectful. We try to set up the boundaries of, if you're calling after hours, it should be for relatively urgent type of issues. So if there's something major going on, I want them to call me. I want to know about it. I want to be able to be that person that they can call and get help when they need it. But at the same token, they're not calling me because, they, had the sniffles and, they waited until, Saturday at 9 p.m. instead of, Friday at 2 p.m. That's not the kind of calls I'm getting. I'm getting the stuff that they're, considering going to the ER, or they are, they were exposed to somebody with, and they're starting to have symptoms and they want to know what they should do to treat. People with, bad GI symptoms. They're trying to figure out what they should or should not try to eat, what level would necessitate an ER visit, and, if they can come in to be seen to take care of that in the office. So they're really respectful. I think that in part, having that initial meet and greet prior to having people sign on allows for both of us to sort of gauge expectations and also to make sure that we're a proper fit. My patients that I have in my clinic are all very kind, respectful type of people. And if they're calling me, I know that they actually need something and I'm happy to help with that.
Yeah. Yeah, that paints a really clear picture of how it can be both like really sustainable and really high touch. How did you decide, I guess, on your membership, like pricing for the concierge model? Like, are there kind of standards out there? Did you have to kind of reinvent the wheel?
So, in my case, I did a combination. I have kind of a friend, colleague, this guy, Dr. Radley Griffin. He was one of the pioneers for this type of model in the Tampa Bay area. And, he's been really helpful in terms of allowing to, ask questions and kind of give a little bit of guidance where necessary. He he was helpful on that stuff, and I can kind of bounce ideas off of him, which, he has a unique perspective on this since he's been around the game since 2008. But I mean, I was also looking at, what my colleagues within the region were pricing, and, if it was physicians versus nurse practitioners, because obviously a little different levels of care depending upon your degree. And then also what the offerings were. I had a lot of different things that I wanted to incorporate into the practice, and I wanted to figure out a way that I could make, an appropriate living off of a reasonable number of patients so that I could maintain that high level patient care, that ease of accessibility that is one of my, my cornerstones of the practice, but also be able to cover all of these different costs as they come up and be able to avoid the nickel and diming that some places do, where they're like, oh, you want weight loss? We're going to put you into our weight loss program. That's a separate cost. And, oh, you want an IV? Well, we'll have you can pay, $150 and you can come in and get an IV. I would rather simplify it for my patients and say, hey, if you need something, come in and we'll handle it. And that's it. If some patients are maybe a little bit more expensive to take care of and some patients are a little less expensive to take care of, it all balances out. We structured everything on an age-based kind of tier. So we have the less expensive prices for people that are coming in that are, 18 to 34, because generally speaking, not 100%, but generally they're going to be lower utilizers. They're not going to have as high of healthcare requirements on a day-to-day basis. Whereas somebody who's, say, 70 is probably going to have a little bit more complexity to them. They generally are going to have more things, if nothing else, because of wear and tear as you age. And, they may require a little bit more time and depth and more of the injectables for arthritis or things along those lines. So the cost of taking care of them may be a little higher. So we tried to adapt that in such a way that it allowed for some of the younger patients that are earlier on in things to have a little bit more accessible pricing, because of the fact that they weren't really going to be utilizing as high a cost with their memberships. So that kind of makes sense.
Yeah, absolutely. Yeah. So you have that tier system, which I assume would kind of follow like a health insurance type of tier potentially to grow them. So have you learned anything with you're a few months into your business? Anything that you've learned that's notable? Anything that you've needed to change?
I think marketing is way more challenging than you realize. I think everybody goes in kind of as this super optimist. They're like, this is going to be amazing. We're going to grow so fast and it's going to be like, you're aim for the stars. And that's wonderful. And I am forever the optimist, and I still am. But at the same time, I think that sometimes we think that something's going to take off a lot more quickly than in reality things actually grow. And when you talk to people that have survived the same process, whether it be in the primary care and pediatrics, going through and starting from scratch, it's a slow process in the beginning. It's a slow build. And that's just the nature of the beast. And I think I had to kind of reset my expectations in terms of the rapidity of growth and focus on doing things that were going to make it a sustainable growth as it becomes, bigger and bigger, and allows for, I guess, the growth process to be smoother rather than worrying about so much of the speed, and understanding that that's the process is important. The marketing, I think it's a big learning curve. We've tried a lot of different angles from, doing ads on Google, the Facebook and Instagram, the, in-person networking, sponsoring of charitable endeavors. That we've done pretty much everything out there. And, trying to learn and figure out what's going to actually reach your demographic, what's appealing to people, what actually makes them say, hey, I'm going to stop and call this person, versus just looking at it and saying, oh, that's interesting. And to some degree, and this is something I've spoken to with my different marketing people, a lot of it is, it's multiple times. They can't just see your ad one time. They have to see it 6 times, and they'll say, hey, I keep on seeing this. Maybe I should give her a call. Sure. So, being patient with the process, I think, is probably the biggest thing that I've learned in this, is that, Rome wasn't built in a day, but build it and they will come kind of thing.
What is your vision for the future in the next 5 to 10 years?
Sure. Well, actually, it's funny. I feel like I had the vision at the same time as I had even the starting vision, because I've had this crazy goal in my head and I'm manifesting it as we speak. But I would really love to create a full wellness home for my patients. So basically, eventually purchase a building to kind of build out myself and have it be a multi-physician practice for the concierge side, but also incorporate other elements of wellness. So have, a massage therapist on site, psychologist for counseling, because accessibility for that is very difficult at times. Having a nutritionist that they can, associate with a dietitian, somebody that can help guide them on that sort of path. Because, it's something that I like to incorporate, but for somebody that has a specific degree in that, if they have a more complicated issue that requires a full plan of day to day, having that person there easily accessible really helps. And I ultimately would really like to basically have it be a fully functional wellness space that they can have everything that they need for mental and physical well-being all in one home. That way they're more likely to actually incorporate these different modalities in our day to day and really optimize their health, really focus on longevity and living their best quality of life that they can, rather than just combating okay, I have diabetes, let's throw a pill at it. I much more of the mentality of living your best possible life, trying to do as much as we can for our body to make it better, not just fix the problems as they come up, more proactive.
Yeah. And I really see the vision of having everything in one spot as being really beneficial, because it is so hard. Like, it's so hard coordinating your own care, and, everything is, there's a different price for different things. It's hard putting it all together.
Absolutely.
To kind of transition towards ending on a personal note, is there anything you're learning, whether it's like reading, any podcasts you're enjoying, anything like that you would share with our listeners?
I mean, I've had a smattering of different business books that I've been trying to read and incorporate. One of the big things, we were trying to come up with our core values and, what we wanted to have as our foundation as we built, because I think having that strong foundation lends to a better construction as you do start to grow and staff, and making sure that everybody has a clear pathway of where they're going. And I mean, even just having a clear view of the future and sharing it and being upfront about it with anybody who's a member of your team or interested in being part of your team down the line. I mean, I've spoken even with, other physicians that have told me that, like, yeah, when you're going to open that, let me know, because I want to be a part of it. It's like,
yes,
I think the more that we incorporate that, and, that's kind of more from the business side that I've kind of learned is, be clear about your pathways, be clear about your messaging for patients and staff alike. And the more that you stay on point with your messages and stay true to the values that you have going in, the better off you'll be. So, it's kind of been a mixture of some of these different texts and everything that I've been reading. I'm trying to remember the name of the main one that I was using, but they've been helpful, and I have been trying to incorporate that as I grow, because as you know, I mean, being a physician does not make you an entrepreneur, and I will take any and all help I can get from outside sources to make sure that I do this the right way, and that it's going to be sustainable for growth and for the amazing future that I have in mind for Ascend Concierge Medicine and Ascend Wellness in the future. And, allows us to grow in the best possible way for both myself, my staff, and my patients.
Your passion and your care for your patients really comes through, like, talking to you. It's really admirable. I really appreciate you coming on the podcast. This has been incredibly insightful. For any viewers who want to get in touch with you, what's the best way to do that?
Sure. So our website is ascendconciergemedicine.com. So Keep it simple. Our phone number, if you wanted to get in touch with us and, find out more about our pricing structure or come in for, complimentary meet and greet, our phone number is 813-859-7260. And you can also find us if you look up Ascend Concierge Medicine on Instagram or Facebook. We have things about the business, about our staff, and also just some, fun little tidbits about different health and wellness tips and things that you need to know. So, feel free to give us a like or a follow if you want to get some, insightful health hints or anything about wellness. But, yeah, we're not too difficult to find. And obviously, if you wanted to plan to pop in, our office is at 15436 North Florida Ave, and we're in Suite 170. It's a beautiful space. We really set it up to try to make it as welcoming and nice and calming for our patients as possible. We want to lead with that warmth rather than that sterility that you can kind of sometimes get. And we just want our patients to have the best possible experience with healthcare, to make them not want to avoid going to the doctor, but rather embrace it and really incorporate it as part of their wellness journey.
Amazing. Thank you so much.
Thank you. It's been a pleasure. Thank you so much for having me.
Absolutely.